Hello, Pat Ziemer here with MagnaWave. My guest today is Dr. Curtis Turchin with the LZR Ultrabright light therapy, and we're going to be discussing today sports therapy utilizing the LZR Ultrabright. It should be an exciting time, a lot of good information, and so we're looking forward to getting right into it. Dr. Turchin, good morning. How are you?
Good morning. I'm fine. And how are you, Pat?
I'm great. I can't complain at all. Beautiful weather that I'm watching outside, so it's a good day.
That sounds great.
Nice windows in it.
That's wonderful. So we're going to talk about sports therapy today. And of course, we're going to talk, as usual, about light therapy. But in addition, of course, we're going to talk about, and you can add some of this, combining synergistically the MagnaWave with the light therapy.
Absolutely. Let me ask you a question at this point before we get going too far.
Yeah.
How long have you personally been involved with the light therapy, with utilizing it in sports applications?
Well, I started using light therapy back in about 1983, so it's been quite a while. I know that's dating me. But in the very beginning, I always treated a lot of athletes. I've worked with a number of professional teams, baseball, basketball, football, college, because my office was right near Stanford, so I treated a lot of the Stanford athletes. So I would say I've been using light therapy with athletes probably for 30 years.
Wow, that's incredible. That's good. I wanted to just put a basis down so people would think, oh, wait, they just started doing this last week.
No, I've got, you're going to see that the slideshow is going to have a lot of footnotes to document what I'm saying. But I can tell you that virtually everything in this slideshow, I can say that through personal experience, it works.
Perfect. I'm excited to see it.
Okay, so an important thing is that light therapy, laser therapy, PEMF, they've all been used in athletics for quite a while. But you're going to find that virtually every professional and college team has some type of light therapy device in their training room. Often it's a laser or an LED.
Correct.
Now we're going to talk about something called low-level light therapy. You might see LLLT. PBM is the new term. It's photobiomodulation, or you might see PBMT, which is photobiomodulation therapy. Now, the LED is a light-emitting diode. You all know PEMF, pulsed electronic magnetic field. And I'm assuming that you understand that synergism in medicine and therapy is where it's at. In other words, if an athlete gets hurt, they don't just take anti-inflammatories. They might take anti-inflammatories. They might have an ice bath. They might use PEMF. They'll use light. These athletes, especially the pros and the high-level college players, they want everything thrown at them because they know it works better. So we're going to go over how this improves strength and conditioning, how this can reduce concussions, and of course that's a big topic these days. Lower extremity, upper extremity injuries, those are very important. How to improve competitive performance, and in the age of COVID, how does this fit in?
Excellent.
So if you have any other questions, you can go to my book. I have LED and light therapy on Amazon. You can also get laser and light therapy on Amazon. Now, basically, LED and light therapy, and Pat, you can chime in if you want to add things about PEMF with this.
Sure.
But there's no question that it works with virtually everything. Now, it especially works well with the things I've highlighted there: frozen shoulder, headache, myofascial pain syndrome, plantar fasciitis, shin splints, etc. And that's because light therapy stimulates the regeneration of every kind of tissue. So that means pain, stimulating healing, neuropathy, sprain strains. A lot of athletes have jaw injuries. There's always neuro problems. Most of them are getting surgery at some point in their career, so it helps post-surgical recovery. It can be used before and after sports. It's definitely used for all kinds of muscle injuries and tears. The important thing now is it actually improves their fitness level. We know that now. It can help with depression and anxiety, especially in the time of COVID, and especially in football and some of the other sports like that, soccer. And sometimes you can say this is true in basketball, is it can help with head trauma. So you're going to hear only the truth. And I like what Mark Twain said, get your facts first, then you can distort them as much as you please. There'll be no distortion of facts. This is all going to be documented, and we're going to have you get to the point where you have more fun, you help more people, and you make more money. That's what our motto is.
And that's for everybody. That's for the practitioner, for the athlete, everything.
That's true. And as you know, it's always survival of the fittest. And whether it's an automobile, whether it's a professional sports team, whether it's a chiropractor, a physical therapist, an athletic trainer, it doesn't matter. Only the fittest and the best survive. So one way of surviving is thinking about your pie. You know, what can you treat? And my bias is everything in the scientific literature says if you use light therapy and PEMF along with everything else, you are going to help more people get well faster. And right now, light is hot. Especially you're seeing things about ultraviolet light curing all kinds of things like infections, COVID, bacterial infections in surgical rooms. So people are thinking about light. So it's important when you sell that you're thinking about light as being a state-of-the-art product. Everything has a brand, and your brand needs to be being on the top of your field. The interesting thing is now we know that LED and light therapy not only helps injuries of all types, but it actually improves athletic performance. And that's important when you're talking to a professional or a college athlete or anybody else of that matter. So we know it helps muscle strains, tears, trigger points, myofascial pain syndrome, tendonitis. We're going to talk about all these deconditioning, extreme muscle fatigue, and what we call peripheral impingement, which is tightness in these peripheral muscles. Let's start here with muscle strains, which is very common. I studied with Dr. Janet Travell and David Simons. They developed the whole concept of trigger points. And trigger points are those black X's, and those spots in muscles radiate pain to all types of areas. You can see how it radiates things into the foot, into the face, down the arm, down the leg. So there's all kinds of therapies you can use to treat these sports injuries. But LED, and I'd have to say PEMF, are the only constructive modalities. You know, spray stretch loosens things up, as does massage. You can get trigger point injections, acupuncture, taping, ultrasound, but they do not create more tissue. And when you're talking about a high-level athlete, it's important to know that that tissue has to heal faster. And that's what we're talking about, PEMF and light therapy.
You know, that's a big point, because when you, and that's a great way that you presented it, because the regeneration of tissue with PEMF, which the NASA study shows that you can have the regeneration of tissue, and it's certainly understood and known that light can do the same thing. Just imagine the two of them together. And something I always say when I talk to my people, the tissue responds more favorably when it's approached from different directions, different intensities, and now we're adding light to keep surprising that tissue, to make it energetic to grow.
Yeah, there was a study I didn't add here, Pat, but I was reading this a few days ago, that they showed that when they compared PEMF and light therapy side to side, they both caused similar types of improvement in symptoms. But what that means is one thing, that they're both effective.
Correct.
And when you're talking about an athlete, all they want is for you to do everything that's effective to get them back on the field as soon as possible. So what I'm talking about now is integrative therapy. So Myofascial pain syndrome is these big areas that are painful, very common in athletics. Deep tissue work, you've probably heard of rolfing. That's a type of deep tissue work for myofascial pain syndrome. And that's because when you overload muscles, you get hypoxia and ischemia, a lack of blood flow. And when you use light therapy and or PEMF, you're actually increasing that blood flow. And you get that professional or college athlete or weekend athlete to feel much better right away. Now you combine it with massage. You can combine it with deep tissue massage. And you can use light therapy before and after. You know, Pat, I'm not sure if you're talking about PEMF being before and after or both, but with light therapy, the interesting thing is if you use light therapy before sports or use it after sports, studies show it's really almost identical. So the main thing is by adding the light to the tissue, you get healthier tissue, whether it's for trigger points, fibromyalgia, ganglion cyst, trigger finger, bursitis, Dupuytren's contractures. All of these injuries can be helped by light therapy. This is what's called spray stretch. It's a common thing in sports training rooms. As I say, I've been in a number of pro sports training rooms as well as in college training rooms. And I can tell you, they throw the kitchen sink at these athletes. And this is one thing that I use quite often with my difficult cases. And you'd use the LED before you spray and then after spray. And spray stretch will elongate muscles.
Would that be similar to where they're talking today about taping, where they tape the? No, I'm not talking about wrap taping, but the you know what I'm talking about, we
call that kinetic taping, Pat.
Kinetic, that's it, kinetic taping.
Yeah, and you know, did I pay you to ask me that question?
Let's see. Let me check. See if I got the check. No, no, you did not.
Obviously, I did not, but that's a segue into my slides that are coming up soon about using light therapy with taping. And of course, I'm talking about PEMF as well. But we're going to go into that. So that's a great segue, Pat.
Great.
So what you see these little dots, and those are on diagnostic ultrasound. And those shows what trigger points are. You can see those arrows pointing to what they call hypoechoic regions, or basically regions of scar tissue that actually show up on ultrasound. So they're real things. They're not imaginary. It's not fake news. Now, here's what's interesting is they find that when athletes, when they have trigger points, the muscle strength is weaker. Now, think about an athlete. An athlete needs strength. They need flexibility. But if they're feeling weak, the problem may be in the muscles themselves. It could be trigger points. So light therapy has been proven. This is from 2020. This is not old stuff. It's recommended as an effective treatment for myofascial pain syndrome and trigger points. Bursitis is also treated well, and studies show this. Bursitis is very common in the hip, in the shoulder. You probably all heard about trigger points and bursitis getting injected with cortisone. Well, the interesting thing is that if someone gets injected with cortisone for bursitis, guess what? Study shows light therapy makes the cortisone more effective. It's not contraindicated. So Achilles bursitis, hip, shoulder, elbow, it helps everything. So studies show that photobiomodulation therapy will increase function with bursitis. Again, that's out of 2019, a very recent study. Tendonitis, the same thing. You can see the bursa there, the tendon. It helps all of that. Well, tendonitis is an inflammation of the muscle. We know that light therapy reduces inflammation, stimulates healing, and gets rid of pain. Tendonitis is different. That is degeneration of that tendon. And when you're using low-level light therapy, it's great for tendonitis, but you have to use it with tendinosis, because tendinosis And basically, I think you can assume any chronic tendonitis probably is tendinosis. That means that tendon is worn out and frayed. And that's the segue, Pat, into using this with tape. So all these different types of tendonitis problems. Here's a meta-analysis that look at a ton of different studies, and they find it helps with tissue repair. That's tendinosis or tendonitis. So here's that segue, Pat, that you were introducing just a few minutes ago. I call this kinetic taping, and that's what that means is you're taping for sports therapy for improved performance. We know that light therapy improves muscle function, it makes the athlete perform better, and we know that both red and infrared light therapy actually improve muscle fatigue and muscle performance. And guess what? We have red and infrared in our light therapy device. Funny coincidence. So with muscle performance, there's a lot of studies showing it improves strength. There's a greater reduction in fatigue. And it has been proven in these studies to reduce muscle damage. It actually makes the tissue healthier. And that's what these athletes need. Reducing fatigue. This is in soccer players with hamstring fatigue. It improves hamstring performance. It improves all kind of muscle performance. This is strength and conditioning studies, medical science studies. Tennis elbow, golfer's elbow and tennis elbow. This is also not only for pro athletes, but this is for your weekend athlete. And I treat so many golfers and tennis players. This is very important if you're dealing with the weekend athlete. Epicondylitis is tennis elbow, whether it's medial or lateral. Medial is golfer's elbow, lateral is tennis. And one thing that's very common in all kinds of athletes and non-athletes is plantar fasciitis. That's pain in the bottom of the foot. And studies now show it's not just inflammation, it's micro tears in the bottom of the foot. And guess what? When you have tears, what do you need? You need something that stimulates healing and repair. So when you see people coming in that are saying, or you're treating patients with this, or you're talking to professionals that need to know about this, remember that if it could be a tear, and that's very common, you don't want to massage it. You don't want to tear it up. You don't want to stretch it. You want to regenerate that tissue for strength and stability. That means PEMF and light therapy. And there's a meta-analysis proving that photobiomodulation therapy reduces pain and improves foot function in patients with plantar fasciitis. You treat the bottom of the foot and the top of the foot, but especially the bottom. And I always use tape because you have to support it. We often recommend arch supports and we give them exercises. Herniated disc. This is very common in athletes. I don't care if they're football, basketball. There's very often you watch a basketball game and you see these players lying on their stomach, up on their elbows. They're trying to heal their own discs. Well, studies show that light therapy actually stimulates the regeneration of the disc. So it basically treats anything. But how does it help that? We know it stimulates the mitochondria. We know it stimulates the cell membrane. But you might not have known this, but light therapy actually straightens cells out. What does that mean? If you look on the left, you see how those cells are disorganized. After one session of light therapy, look at how they're lined up. That's straightening out the cells. And that's because a cell actually has a little skeleton. It's called a cytoskeleton. And there's something called tensegrity, which is the strength of the cell itself. Robert Navio, who's an MD PhD out of UC San Diego, he's a professor of medicine there. He's proven that when you use light therapy, these cells straighten out. That's exciting news. Think about this as light therapy actually cures cell scoliosis. It makes the cell healthier. Now, every training room, I don't care if it's high school or college, pro, they always use tapes. You need to know that tape and light therapy are extremely synergistic. And studies show that when you use kinetic tape, again, this is like what we're talking about earlier, Pat, is synergistic therapies. We're talking about PEMF, we're talking about light, we're talking about tape, because studies show that taping improves muscle strength and push-off force in these runners. So soft tissue work, light therapy, tape, PEMF, these all work together because the light and PEMF stimulate tissue regeneration. Tape protects the joint, also increases strength, and improving strength is really important in light therapy, laser therapy, PEMF, and taping. So here we see the patients with myofascial pain syndrome. They got kinetic taping. There was a statistically significant improvement in pain and upper muscle trapezius strength. How about ice? Well, ice by itself, studies show, well, it's great, temporarily reduces inflammation, but it also reduces some of the recovery aspects. Same thing with heat. They both have problems. So studies show that ice is not as effective as photobiomodulation therapy, but the interesting thing is using ice before light helps because it gets out some of the blood so the light therapy can get in deeper. So we tell your practitioners, your patients, light therapy after ice. So ice for 5 minutes, maybe 10 minutes at the most, then use light, and studies show that actually improves the results. Sprained ankles are everywhere in sports. Studies show it helps that. For all the different ligaments, it actually regenerates ligaments. Here you see one of my patients with tape on them. That's for a sprained ankle. It improves muscle performance. It improves delayed onset muscle soreness, so that reduces muscle damage. Also, head and face trauma. This is not only a big thing in baseball, it's a big thing in football. And as I mentioned in the last slideshow, it's fascinating that Harvard Medical School and Johns Hopkins now have departments of photomedicine, and they're both talking about using light therapy on the brain to regenerate the brain. But even for pain, those are trigger points, myofascial pain syndrome, from concussion injuries. Now, here's a Harvard brain study. This is one of the early studies in 2009. So we're talking about 11 years ago. They proved that using light on the brain decreased depression and anxiety. They put it right on the brain. They proved that it goes into the brain. And you can see on the left, there's very little circulation on the brain. After light therapy, look at the increase in brain function. And you can see that after one session, there was a decrease in anxiety and depression for more than 1 month after one session. There's over 200 studies showing it improves cerebral blood flow, which is an important part of cortical and cerebral function. So what happens? Well, it's putting energy into the cell. Some goes in reflection. Don't put oil on the skin. It increases reflection. You want to get it deep into the tissues. You want to get those mitochondria stimulated because it wakes the mitochondria up. It's not like ordinary white light. It's a unique wavelength that gets deeper into the tissues. It's that optical window of 600 to 900 nanometers. That's why it penetrates more deeply than standard light. You can see that in that optical window, in that middle area, there's very little absorption by water and by blood. That means it can penetrate deeply. But there is some absorption, so you are getting it into the blood to some extent, and into the skin, and into water, but most of it penetrates deeply. And you can see that these wavelengths also, this is the US government. This is a study by the DARPA. You can see that there's something called the Arndt-Schultz law, which means the dose needs to be precise. What does that mean? Generally with our unit, you're talking about 1 to 2 minutes. Very simple. But you can start with 15 seconds, go up to 30 seconds, build up. But you're going to find that usually in most people, 30 seconds per area is enough. And you're going to increase all of this. Believe it or not, light therapy, and I'm assuming, Pat, you're going to say the same thing about PEMF, it improves every type of cell activity. It also blocks pain because it acts like a non-narcotic nerve block. Notice after one LED treatment, there's a decrease in nerve activity, and after 2 treatments, look at that.
It's incredible.
Yeah, it just blocks the pain right away. So 8, 10, and 660, which you're going to see in our light therapy devices, it's been proven to go 2 to 3 inches into the spine and penetrate into the skull. Because you want to get through all these different tissue layers. Some will bounce off of photons, some photons will go deeper, some will be absorbed into the subcutaneous tissue, and some go as deep as 9 inches, believe it or not. So that shows what light therapy does. It penetrates deeply and superficially to help all levels of tissue. Always put it directly on the skin unless someone says it's too stimulating for them, because the further away you are, the more backscatter there is. So if you're treating a high-level athlete, and some of these athletes, I've treated 300-pound football players, you need to push the probe, the light therapy device somewhat into the tissue to get deeper, because studies show it will go deeper. So it acts like a nerve block. It acts to stimulate healing. Why you don't want a hot laser? Because there's a lot of risk of injury, and if you have too much heat, you will slow healing. But with very low power lasers and LEDs, they just don't work. The amount of power is very important. So hot lasers do have burning potential. Our device was not. So low power can be ineffective. Our LZR Ultrabright, we feel, is a perfect balance of power. In 1 to 2 minutes, sometimes less, sometimes 30 seconds, you get dramatic improvements in the patient's condition. Because if you have too much heat, you're going to burn the chicken. That's called the baked chicken principle. I developed that. The hotter the LED, the hotter the laser, the more superficial it is. So you want the proper balance, and we feel we have that. And you can see if you cook your chicken 15 minutes at 1200 degrees, boy, you're going to burn the crap out of that, right? But if it's 60 minutes at 300 degrees, yum. Or how about going to a barbecue joint where you might cook it at very low temperature for 12 hours, yum, 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 right? So getting deeper requires just the right balance of power or heat. You can move it 1 inch every 2 seconds, or you can provide it directly on a spot. Now, also, it's been proven that light therapy is like an anti-inflammatory. A COX-2 inhibitor, which is the top anti-inflammatory you can get, it has been proven to be as effective. Which to use, light or PEMF first? Well, from my point of view, I know it doesn't matter, but Pat, you may have, some ideas about this. We can talk about this as soon as I'm done, because I'm going to wind it up very shortly. But I would say probably the main thing is use your PEMF, use your light therapy before or after. I don't know, but you're going to use tape after that. So why are sports injuries so different? Because the speed is different, the force is different, how this all happens is different. You get problems in young kids that you don't get without sports. It's repetitive. And these athletes, they want to get back on the field very fast. So for a top level athlete, a chronic sports injury problem means they've had it for 2 weeks or longer. Usually with chronic conditions, we say 3 to 6 months, but not with an athlete. After 2 weeks, they're getting worried. So it helps with promoting healing, managing inflammation, restoring fitness, and treating the cause. All kinds of injuries can be helped because it helps all kinds of tissues. It can penetrate 2 to 9 inches. Higher doses will block pain more, but lower doses are more stimulating for healing. So you choose the one you want depending upon the particular athlete. But when you use it, you're going to tell me, the patient's going to tell you, and I'm telling you, that the patient will feel less tenderness or pain. You will feel less muscle tension. The trigger point will be smaller. There'll be less edema, and the patient will say, I feel better. Acute, maybe a few times a week. Long-term, 1 to 2 times per week. If it's post-surgically, it can be multiple times per day. You can use it before or after massage. If you do use cream or oil, it's always before the cream or oil because that will block some of the penetration. So you always use the LED before massage if you use cream or oil. It is safe over plastic, metal, glues, sutures, even spinal cord stimulators and pacemakers. That's very important. It's very rare to have an injury, but it can cause a flare-up if you use too much. So always start with a lower dose, like 15 seconds, 30 seconds, and then build up. Now, if you have a 300-pound lineman, a low dose might be a minute. If you have a light-skinned female like this, low dose might be 15 to 30 seconds. So it depends upon the athlete. You can actually strengthen the joint. Studies show that light therapy stimulates ligament regeneration. A very high overdose will cause scarring. What's good about that? Well, if you use a moderate dose, you actually get increased thickening of the connective tissues, and it reduces this hypermobility. This is called a Baton's test. This is a chronic hypermobility problem. It definitely helps hypermobility. COVID in sports is a big deal. You're starting to see some basketball start. You're starting to see some baseball start. But I can tell you right now, having been in these training rooms, these people do not want to be with a lot of other players. They don't want to get sick. So this is a perfect way to have the athlete treat themselves in their hotel room or in the privacy of their own home, because the athlete can treat themselves. What do you tell them to do? Simple. Paint for a minute or two, and then 10 to 20 seconds on the most painful spots. And they can do it multiple times if it's an acute injury, multiple times per day.
Question: when you talk multiple times, and this is something that, you look at somebody and you say, okay, you're a 300-pound athlete, and so a standard dose for you is going to be 2 minutes. Do they, in their mind, I would think that sometimes they're saying, there's no way that putting this light and this heat on my hamstring or my shoulder for 2 minutes is going to do the job. And so you say multiple, can potentially in an acute situation can be multiple times a day. Is that with some separation between treatments, like you do 2 or 3 minutes now and then 2 or 3 minutes in 2 hours?
Yeah, I would say using it every 2 or 3 hours is a good idea, especially in acute pain. And what happens in pro athletes and college sports is they get an injury, and you ask them, how fast you want to get back on the field, and the answer is today or tomorrow, right?
Right.
So, with your weekend golfer, they might say, well, I'm playing with my buddies in a week or two, so I've got a little time. Okay, so treat yourself once a day, maybe twice a day. But if you have a very high level athlete, they can, well, I've treated Olympic athletes, and they say, I'm leaving for the Olympics in 1 week. How often can I treat myself? I say 3 times a day for 2 to 3 minutes each time. And I just say, look, if you get a flare up, just back off a little bit. Why do I say that, Pat? Because with these high level athletes, the kind of flare up you're going to get from this is extremely mild. I'd say you might feel some soreness. They say, I already feel soreness.
Yeah.
What the hell are you talking about? I say, well, just if it increases the pain a little bit, just back off a tiny bit. And they'll go, okay, okay, okay. You know, these guys, you know, women, they don't worry about that because they're in pain all the time. So I would say every 2 or 3 hours is a good algorithm, Pat.
Okay, perfect. And
So
very
the nice
similar
thing
to that
about,
with
like,
PEMF.
I'm sorry.
We're very similar to that with PEMF. We talk about you might do a 20-minute treatment on an athlete on their back or their hamstring, that particular type of thing, and then come back 4 or 5 hours later and do it again when in an acute phase. So these, again, the synergistic situation of these two is incredible.
Yeah, and you know, if an athlete has access to both, I tell you, they're going to say they want both. I've treated pro athletes. They want both.
Right. I understand.
Okay, so the nice thing is light therapy is antiviral. So if an athlete says, you know, I had COVID, or, you know, my lungs are feeling a little funny, you know, this is not cleared by the FDA, but you can put it on the lungs, and studies show it actually penetrates into the lungs, and it is antiviral. So a lot of people use it with asthma and things like that, and you can put it on their back because the back, you know, will be flared up with a lung problem. You can say, look, I'm treating your back, I'm treating your chest. You don't have to say I'm treating your lungs, I'm treating the virus. Don't say that because that's not approved by the FDA, but you can still treat over those areas. Anytime you get one of our products that's produced in an ISO 13485 facility, which is the highest level of quality, so you know you're getting a great product. Any questions?
Oh, there's several questions, but I wanted to, I think that information you covered so much. And from a practitioner's point of view, you covered a lot of things that I'm sure starts them thinking about how they can make applications and as far as utilizing the product. I would like to talk about some specific injuries, if you will, hamstring being one that's huge in football, soccer, a lot of these types of areas. How would you approach a hamstring, for example, from the get-go?
Well, of course, the first thing you look at is how long have they had it. If it's a recent injury, there's going to be a little bit of spasm there. And you can have the sports therapist, the doctor, the massage therapist, the trainer, just palpate that area and see if there's a tear. So if there's a tear in the tissue, you're going to have to tape it. But I would say the important thing with a hamstring strain is use the PEMF and use the light therapy right away, because the sooner you use it on that tissue, the faster it's going to recover. With most athletes, they're very conditioned. You know, when I've been in pro sports training rooms, Pat, I've seen that these guys will, I'm saying guys, but you know, women too in certain kinds of sports. I want to be somewhat politically correct, but you know, what happens is they're spending 2 hours in the gym every day, and they're spending an hour stretching, and then they're playing their sport an hour every day. This is even just in training and preparation.
Sure.
So this can happen at any time. And the main thing is with hamstring strains is knowing that you treat where the hamstring starts, which is, some people call it the origin or the proximal insertion, and you treat the end, the tendons that are distal, or let's say near the butt and near the knee, and then you treat the area in between. And you treat the spot, Pat, that hurts the most, and that might get 20 or 30 seconds. And then because there's a plastic shield over the front, you can actually do some mild massage with the light therapy device to go over the entire area. And then you have the athlete stand up, Pat, and say, how does that feel? And then you can say, well, it feels a little better. And then you say to them, you have to provoke them, is there any area that still feels more painful than any other area? And they'll point to a spot. And you say, okay, lie down, and you put it on there for 20 or 30 more seconds. And you say, stand up now, how do you feel? And they say, well, that spot feels a little better. And then you're done.
And you know, the application there, as I was listening to you talk about that, to do the LZR first, to do exactly what you talked about, then they could do the PEMF or the PEMF, if you will, or they could tape at that point and then do the PEMF to gently massage with the pulsing as the tape is on, the hold things in place for a longer period of time. They could do that for like 15 minutes to help and do the whole area with the large coil and do the whole area of the hamstring.
That sounds like a great synergistic modality to me.
Yep. It's exciting when you think about it that way. And then, of course, they could remove the tape later and then come back and do the light again, or do the light and the PEMF again.
You know, this is the interesting thing about sports, Pat, is this is a very creative field. I remember when I was working for a laser company, they sent me down to a pro sports team. And I became a consultant for this pro sports team. And I was talking about using this with injuries. And then I went back about a month later and talked to the trainers and some of the pitchers. This was a pro baseball team. And I said, how's it going with your injuries? And these pitchers all looked up at me and said, we use it before the game and after the game, because I find if I put it on my shoulder, I actually throw better. So we do it before and after a game, not just with an injury. And, you know, that's why sports is so creative, because with PEMF and light therapy, you're talking about using it in very creative, innovative ways. And what you're suggesting, Pat, is a very innovative way of using these modalities synergistically.
Exactly. Now, how would you approach? So let's talk about a knee strain or an ankle strain, the initial use of the light therapy, and then let's couple in the PEMF and the taping.
So when you see that athlete come in with a sprained ankle, usually you're going to see some swelling.
Correct.
If you see that the whole foot is black and blue, you may have a ligament tear. So, you know, with a pro athlete, with a high school athlete, with a college athlete, usually at a minimum, the trainer is going to say, go out and get an x-ray, make sure you don't have a fracture. So if that x-ray comes back negative, then the trainer or the sports therapist, sports physical therapist, sports chiropractor will check to see, since most of these are inversion sprains, they'll see if the foot inverts. That means the plantar part of the foot going inward, where that sprain, where the foot tucks under on the lateral side. If that's loose, then you want to use what we call light prolotherapy, where you give a very high dose and you tell that athlete, I'm going to make you more sore. And you put the light on there until it feels a little more stable. And it will feel more stable after a minute or two. And then I would suggest you tape it and then put PEMF on it.
Exactly.
Because you can use PEMF with the tape on.
Exactly. Well, perfect. And that's kind of the things I wanted to get at, is just to give a little guideline to a way that someone might use it, so they have a better understanding of how to move in that direction. And you hit a key point when you talked about that you can use the PEMF right over the tape as they do it. And I also liked earlier you were talking about using the ice first to kind of clear things up. and then come back with, after dry, of course, then come back, I would think at that point, either one, the PEMF or the light, because the neat thing about PEMF, I know the light will do the same, but the PEMF is such a large, if you talk about the size of the coil, inflammation reduction device. So you can work the whole area where there's trailing inflammation. That was a big thing for us at one point in time. We would go to the spot, as you talked about, and we would treat that, but we'd forget about the inflammation through the fascia, through the elongated part of the muscle. If we'd go after that also, then we could really enhance our results. And so using the light, and correct me if I'm wrong here, using the light on the spot, followed by the PEMF on the spot, and then do the whole muscle bank itself with a larger coil would really, I think, give some energy to the body.
Yeah, we had an old phrase we'd say, when the injury moves next door, the neighborhood goes to hell.
Correct.
And what that means is, and you can do this with light therapy too, studies show if let's say you have an ankle sprain that turns out to be a fracture, and they end up putting a cast over it, all you have to do is lie the athlete down, put the light therapy behind the knee, and you can use the blood to carry the photons into the ankle. If someone has, let's say, surgery on their knee, a pro athlete, you want to heal them faster, they can put a cast over the whole leg except maybe in the groin, and you can put it on the femoral artery and actually stimulate bone regeneration. So the beauty of this, Pat, is that both PEMF and light therapy are not only synergistic, but they're actually full body modalities. They've even found that when you put light on the feet, there's a change in brain chemistry. And some of the earliest studies in the 60s showed that when you use light therapy on a wound, even if you do the wound on a different part of the body, another area will actually heal up faster as well. So I'm excited to work with you more, Pat, on combining these, because these modalities just sound like they're a perfect fit together.
Well, and the new generation of the device with the plastic shield over the front and the way you've shielded the fan and so forth, they can actually be used in many cases at the same time. You can use the light and the PEMF at the same time. Now, when you get if you're dealing with a great big athlete where you turn the PEMF way up, you can still interfere with that fan a little bit. But as a rule, you could use both of them at the same time in some cases.
Sure, like with the hamstring strain. I remember treating a hamstring strain on a football lineman, and he was about 350 pounds. An African-American guy, big guy. And so I'm saying that because when you use light therapy, black skin will absorb more photons. So we have to paint over the area more. But I remember when he lied on his stomach.
That's called paint, meaning moving the light over the area.
Yes, about 1 inch every couple seconds. And so I had to paint over his hamstring because it was so big and swollen. And this is the kind of guy, when he walked through the door, it got dark because the guy was so big. And he got up and he said, I feel better, bless his heart. And I've seen athletes that have been off the field for literally months, and then in a week, they're actually back in the game. And the beauty is that if every team had a PEMF device and light therapy devices, and of course, our device is relatively inexpensive for a college athlete or a pro athlete, they can each have one and they can take them home and they can use them also, when they're at home.
Sure. Absolutely. Incredible information. A couple more questions for clarity. When you talk about length of dosage or a standard dosage, I know we've talked about it before, but just a standard dosage would be a minute, or 2 minutes. Of course, again, you're right. It's the skin tone of the person and the whether it's a smaller person or a larger person. Those things are important. But talk a little bit about standard dosages.
So I would say the average dose is 1 to 2 minutes. And I would say the first time you use it on a patient, maybe do about 30 seconds on a couple spots. Why? Because that's what we call titration, meaning you're starting off with a lower dose. However, if this is not a high-level athlete, now with a 350-pound lineman, I know, I can guarantee you it's pretty hard to overdose a guy like that. But if you're treating, let's say, I shouldn't use this term, but it's a common term in the media, is a soccer mom. And she plays tennis, and she's about 5'2", and she weighs 95 pounds dripping wet, but she's athletic, and she has bright white skin. Honestly, the first spot I would treat would be 15 seconds and 15 seconds. And then I would say, see how that feels and come back. And if she comes back and says, you know, I felt a little bit better, but no flare up, I'd go right to 30 seconds and 30 seconds or even more. But if you get someone like that who comes back and says, well, you know, 3 days later, I felt a lot better, but for a day I did feel more sore, I'd actually drop back to 10 seconds and 10 seconds. So the bigger the athlete, the darker the skin, the more you paint. The lighter the skin, the more you know the light is penetrating. The bigger and more hardy the athlete, the longer the treatment time. The smaller the athlete, the lighter the skin, the shorter the treatment time. And then there's those patients, if that same light-skinned lady said, well, I don't take Advil because one Advil upsets my stomach and gives me a headache. I mean, you know you've got a sensitive patient there. So just back off. But on average, Pat, that's a good question. I would say 1 to 2 minutes is average. And initially, I'd split it between 2 spots.
Well, I'm going to tell you what, this has been very educational, and showing the synergy between the two modalities is, I think, wonderful. What I'd like to do, if we could do this at a later time, is get more deeply into specific indications that athletes may have. I mean, the procedures, as we say with PIMP, can be the same, whether it's an elbow, an ankle, or a wrist, or wherever it may be. But people want to talk about, what about my shoulder issue? What about my, so maybe we can have another session at some point to where we talk specifically about several different sports indications.
Well, Pat, I'll tell you, since I've been using light therapy for 40 years, and because I've treated a lot of pro athletes, college athletes, Olympic athletes, I could very easily do a half hour, an hour, looking at the foot, the knee, the calf, the hamstring, looking at fat, looking at tennis elbow, golfer's elbow, shoulder injuries, neck injuries. That would be not only easy for me, but fun. So I would enjoy doing that with you, Pat.
We'll do that. We'll schedule up a time, and we'll make some, whether they're 30-minute sessions or hour sessions, we can break them up or whatever, but get into more specific areas, because people really want to do that. I mean, we have the question all the time. Our therapy is put it on and treat it. Someone will say, what do I do about this injury? Specifically, put it on and treat it.
Well, that's what I think is really fun.
Great. Well, Doc, I really appreciate you being here with us today. I think it's incredible, and we look forward to doing more. Dr. Curtis Turchin, the godfather, the specialist, the expert in light therapy. Thank you for being with me, and we look forward to doing this again. Have a great day.
You too. Thanks a lot, Pat.
Thanks, folks, for being with us. Bye-bye.